So to adjust a pregnant woman who's had a C-section, it's really, really important, again, like when they're pregnant, that you don't want to twist them excessively. If your patient is pregnant, you do not want to twist them aggressively because the structures in there, while they're strong, it's not something that you want to use excessive force. You don't need to use excessive force because they have relaxin in their body, so that it's easier to move like butter. If a patient is stuck and you can't get something to move, it's really stuck then. So in terms of adjusting, if I'm going to adjust the patient, obviously when they are pregnant, we're going to exercise caution. I have her in this position. Is this comfortable? Mm-hmm. Okay. So if I bring her like this, so in doing a patient that just had a C-section, you want to make sure that this area doesn't twist, and you want to have the patient be really aware of this area. So if I have you right here, my force is not going to be pulling her over like a diversified move. It's going to be more Gonstead, where you're setting, so the vector that you're hitting is pushing down here instead of whipping her around. Does that make sense? Doing that when they're pregnant, you want to be careful of this area. You really don't feel like you have all that weight in the front like you did before. Because remember when that would happen, I put a pillow under here. And that's something we might do right now just to keep her safe. Because the last thing you want to do is hurt your patient. I'm going to roll you up like this and down. Okay, got you right here. Does that feel a little more comfy? Kind of. Not so much as when you were pregnant. That was really helpful. Yeah. So I got her right here. So I'm going to put my finger right in her SI joint and put my hand here. I'm going to use my leg just for balance. And again, I'm not going to whip her around. You okay with that? Mm-hmm. At every point, you want to check it. You okay with that? Mm-hmm. Just a little tap, just to see if you can get it to move. That did not move. So what I would do is either do some more massage or approach the other side to see if I could get it to unlock instead of using excessive force. So let's have you on the other side. You can always take your time with things. You don't have to rush things. If you have patients waiting, it's really important, because that one time you rush would really hurt, and then Harmon would never come back. There you go. Nothing in a chiropractic office should ever be painful. Got you right here. Is that okay? Mm-hmm. So again, I'm going to bring her over. I'm going to check in. Are you doing okay? Mm-hmm. And that moves. Have you on the other side. So once we got that unlocked, sometimes the other side will just open. So again, you want to be as a chiropractor, you want to be very specific. I'm talking to my DOs, you can be less specific, but you don't want to use any of those full lever moves where you're really whipping the patient around. I got you right here. I'm going to bring you right down. And I got her. So again, sometimes it's like a Rubik's Cube. If you get the one side to go, you'll get the other side to go. But that's the level of force, and that's the technique I want you to use, where it's more of a slow stretch, like we talked about before. If the patient is apprehensive, you're a little apprehensive now with having a C-section, you think? Or last week you were very apprehensive with getting adjusted.
Yeah, this week I was just very aware of what's going on with the abs to make sure we don't push too hard with it. Yeah.
Was that okay for you? Is that scary? So you want to, like, as I said, you don't want to do any sudden moves. You sort of want to like ease your way back into this so you can still get the same results, and check in with the patient to make sure they're comfortable the entire time. Cool. That was awesome.